Hello. I'm Dr. Sulla. Welcome to this educational session on the Glasgow coma scale, a critical and widely used neurological tool for assessing a patient's level of consciousness. In this session, we will learn the components of the GCS, how to accurately perform the assessment, and how to interpret the findings to guide patient care. By the end of this session, you'll be able to correctly assess the GCS score using the three core components: eye-opening, verbal response, and motor response. You will also learn how to monitor changes in consciousness over time. The Glasgow Coma Scale, commonly known as GCS, was first introduced in 1974 by Professors Graham Teasdale and Brian J. Jennett from the University of Glasgow. It has since become an essential part of neurological assessments. GCS is a neurological scale designed to provide a reliable and objective way of recording a person's conscious state. It helps healthcare providers quickly assess and communicate the level of consciousness. The scale evaluates three main components: eye response, which ranges from a score of 4 to 1, verbal response, from 5 to 1, and motor response, from 6 to 1. We'll now go into detail on how each is assessed. Let me explain the Glasgow Coma Scale. We use it to check how awake and responsive a patient is, especially in ICU or after trauma. There are three parts: eye-opening, verbal response, and motor, movement, response. Each part has its own score, and we add them together to get the total GCS. The higher the score, the better the brain is working. First, eye-opening, E, we check if the patient opens their eyes. If they open them by themselves, they get 4. If they open to voice, that's 3. Only open to pain? That's 2. No response at all? Just 1. If the patient is physically unable to open their eyes due to swelling, we record C for closed. Second, verbal response. Now we listen to how they speak. If they talk normally and know who they are and where they are, that's 5. If they're confused but still talking, give 4. Saying strange words? That's 3. Just moaning or making sounds? That's 2. No sound at all? 1. If the patient is intubated or has a tracheostomy, and cannot speak, we use T. Third, motor response, M. This one is about how they move. If the patient follows commands, like squeeze my hand, they get 6. If they push your hand away when you press a painful spot, that's 5. If they just pull away from pain, but not directed, give 4. If their arms bend inward in response to pain, that's 3, we call it decorticate. If their arms go stiff and straight out, that's 2, that's more serious. And if there's no movement at all, it's 1. Peripheral painful stimuli. Nail bed pressure. Apply firm pressure to the base of the fingernail or toenail using a pen, penlight, or any similar blunt object. This helps evaluate the patient's response to pain in a safe and controlled way. Central painful stimuli are used to assess deeper brain responses. Trapezius pinch. Firmly grasp and twist the trapezius muscle, located between the neck and shoulder. Supraorbital pressure. Apply pressure to the notch just beneath the eyebrow ridge. Use this method with caution to avoid potential nerve damage. Sternal rub. This involves vigorously rubbing the knuckles over the patient's sternum. It is less preferred due to the risk of causing bruising. Interpretation. Interpreting the Glasgow Coma Scale helps guide clinical decisions and patient management. A score of 13 to 14 indicates mild impairment, the patient is slightly confused. A score of 9 to 12 suggests moderate impairment, with noticeable difficulty in following commands. These patients require close monitoring. A score of 3 to 8 reflects severe impairment or unresponsiveness, and requires immediate medical intervention. A drop in GCS score may indicate neurological deterioration and needs urgent medical attention. Regular monitoring helps track patient progress or decline. The GCS isn't always applicable. Limitations include intubated or tracheostomized patients, where we can't assess verbal response. Patients who are sedated or intoxicated. Physical barriers like swollen eyes. PERLA is a helpful mnemonic to assess pupils during a neuro exam. It stands for pupils equal round reactive to light and accommodation. How to assess PERLA? You'll need a pen light, a millimeter ruler, and a dimly lit room. First, check that pupils are equal in size and round. Unequal pupils might indicate brain or nerve damage. Then, shine the light. Pupils should constrict in both eyes. The opposite one also constricts. This is called the consensual response. Finally, test accommodation by asking the patient to focus on a far object, then your finger near their nose. The pupils should constrict when focusing on the near object. Enjoyed the video? Give it a like and share it with your fellow nurses. We'll keep bringing you more useful nursing knowledge and support.